The next step in the nursing process is diagnosis. So what is NANDA? The North American Nursing Diagnosis Association International. This organization is composed of nurses from all areas of nursing, including practice, research, education, administration, and specialty areas of practice. Nursing diagnoses are developed through comprehensive research and data collection. New nursing diagnoses are published biannually. Accurate identification of nursing diagnosis for patients is critical to the professional nursing practice, as delineated by the American Nurses Association Nursing Scope and Standards of Practice. Professional nurses are required to make accurate, applicable nursing diagnoses to guide quality and individualized nursing care of patients. Consider ethical and legal consequences for failure to identify areas of concern that require treatment. Understand that implications of delayed recovery, further negative health issues, and if it occurs, the death of a patient. Realize the ultimate risk for litigation involving the nurse in the event of lack or poor performance of identification of nursing diagnostic statements. Here is your Nursing Diagnosis Handbook, where you can locate approved NANDA nursing diagnosis labels. Section 1, Part A in the introductory information of this book is a very helpful guide to help you learn the nursing process and develop a nursing care plan. This book will help you learn how to correlate nursing diagnosis with the known information you've gathered during your assessment. This book will also assist you in identifying NANDA diagnosis statements based on your assessment findings, develop goals, ensure your care plan consistently addresses the same topic by using NOC and NIC labels, develop evidence-based interventions that will help your patient reach their long and short-term goals. In this step, the nurse makes clinical judgments about the patient's experiences and responses to problems of life events identified during the data collection and assessment process. Professional nursing practice demands that nurses continually develop their nursing knowledge and critical thinking skills and apply this knowledge to patient care using the nursing process. Evidence-based practice enhances a nurse's ability to provide the most effective care that has been proven by research. By implementing measures that have been proven through research, the use of evidence-based practice and clinical expertise assure that the patient's values and needs are addressed as the nurse delivers quality, cost-effective health care. So you remember we reviewed before that there are 3 types of nursing diagnoses. Careful consideration of the patient's subjective symptoms and the objective signs of data yield one of the 3 types of nursing diagnoses from which an individualized care plan is created. Actual nursing diagnoses identify existing problems or concerns of a patient. Risk 4 nursing diagnoses apply when there is an increased potential for vulnerability for the patient to develop a problem or complication. Health promotion nursing diagnoses are used in situations where patients express interest in improving their health status through positive change in behavior. It is important for you to understand the difference between medical diagnoses and nursing diagnoses. Nursing diagnoses take into consideration a patient's attitudes, strengths, and resources, not just the medical problems identified, which are critical for planning holistic, individualized care. Risk nursing diagnoses guide the initiation of treatments to avoid potential problems. Health promotion nursing diagnoses identify potential opportunities for the patient to have health improvement. Let's go into some more depth regarding how do you write a nursing NANDA diagnosis statement for your patient. You'll be writing 3 types of nursing NANDA diagnosis statements in this program. You will, based on your patient's problems, write either an actual nursing NANDA diagnosis, which contains 3 parts, a risk for diagnosis, which means my patient does not actually have this problem currently, but is at risk for developing this problem, or a health promotion nursing diagnosis. Actual nursing diagnoses are written with 3 parts. It'll contain a NANDA-approved nursing diagnostic label, as we demonstrated on the previous page. Then you're going to write R/T or related to, and you're going to put the etiology or cause. Now remember I told you it cannot be a medical diagnosis, so you need to open your book, your med-surg book is preferred, and look up the etiology or the underlying cause of what is causing this current problem for the patient. And then you're going to go back and look at the things that you assessed in your patient, subjective and objective, and find 3 pieces of evidence and write AEB, or as evidenced by, and give me 3 pieces of evidence that prove your patient actually has this NANDA diagnosis. If your patient has no identified problems, you would move on to the next type of NANDA diagnosis. If your patient does have actual problems, you are required to use actual nursing NANDA diagnosis for all of the areas that you're assessing. If your patient has no identified actual nursing problems, though, you're going to move to the next level, which was risk 4 diagnosis. The risk 4 has 2 parts, a nursing NANDA diagnostic label, and then you're going to say related factors, R/F, indicating where the patient's vulnerable for developing this risk or problem. If your patient has no actual and then no risk for problems, you would move then forward to develop a health promotion nursing NANDA statement. And these usually begin with the words readiness for enhanced. Standardized lists of nursing diagnostic labels are available at the beginning of your nursing care plan book. It is a nurse's responsibility to accurately identify and use nursing diagnoses for every patient to develop patient-centered goals and realistic outcome criteria in your individualized plans of care. Patients may have multiple problems requiring a variety of nursing diagnoses. Regardless of how many nursing diagnoses the patient has, it must be considered in the planning process. The diagnosis label is taken from the official NANDA list. It is in the first section of every nursing diagnosis handbook. It is described as a diagnostic focus that requires nursing judgment before assigning it to a patient. To accurately identify nursing diagnosis labels for a patient, the nurse must know the definition for the diagnostic label, cluster and analyze related assessment findings, and make clinical judgments based on the patient's condition. Risk 4 factors are environmental, physical, and psychological or situational concerns that increase a patient's vulnerability to potential problems or concerns. Defining characteristics are traditionally written as the third part of an actual nursing diagnostic statement. You should be using the evidence or defining characteristics that you gather during your assessment phase and use these as defining characteristics as your AEBs or your evidence that your patient has this NANDA diagnostic label. You can also look up the NANDA label in your nursing diagnosis handbook and see if your patient has the defining characteristics listed for that NANDA diagnosis. Accurate identification of nursing diagnoses requires analysis of assessment of data and clustering of related clues and information. Verifying specific nursing diagnosis for a particular patient or situation follows accurate analysis and clustering of data. Remember that the assessment findings that you've listed in each box of your functional dimension care plan should be used as your evidence for each of the diagnostic labels that you're creating. When you document all of your assessment findings in each of the boxes of your functional dimension care plan, you are creating data clustering. This clustering involves the organization of patient assessment data and helps you group similar underlying causes together. The nurse looks for patterns related to the data that might support specific nursing diagnoses. Analysis of this data may yield several clusters that related data that might give you clues to nursing diagnosis that you could utilize for this patient. Before assigning diagnostic labels, the nurse consults with the official NANDA list to ensure accurate use of the nursing diagnostic label. The nurse writes nursing diagnostic statements as needed to address the highest priority needs for the patient. Remember, if your patient has an abnormal finding in an assessment, you need to address this with an actual NANDA diagnosis statement. If there are no identified abnormals, then the next priority is a risk for NANDA. If the patient is not at risk for anything, then you can write a readiness NANDA or health promotion NANDA. These diagnostic statements are uniquely based on the assessment of data for each patient. Accurate nursing diagnoses are foundational to the development of an effective and personalized plan of care. Diversity considerations. Lifespan. Assessment that is specific for each individual, regardless of age, is important to establish accurate and applicable nursing diagnoses. Making assumptions based solely on a person's chronological age without thorough assessment may lead to impersonal, generalized diagnostic statements that do not reflect the patient's true condition or circumstances. Culture, ethnicity, and religion. Although some medical diagnoses are more common for specific ethnic groups, how patients respond to illness varies dramatically, requiring individualized identification of nursing diagnoses. Consider the impact of cultural food practices on their influence on the patient's health when identifying nursing diagnoses. Some care plan interventions may conflict with the patient's religious practices. A thorough assessment of each individual is crucial for the accuracy in nursing diagnostic statements and subsequent interventions. Disability. The incidence of chronic diseases and conditions, especially high blood pressure, diabetes, and cancer, varies widely by race and ethnicity. The primary focus of nursing diagnosis in the acute care setting is current illness or exacerbation of chronic illness rather than long-term or permanent disabilities. When patients with disabilities are being treated for acute or chronic illnesses, the nurse needs to understand their capabilities and limitations. This enables the nurse to identify appropriate nursing diagnostic statements that address current patient needs and provide individualized patient-centered care. The nursing diagnosis step of the nursing process leads the nurse to the planning phase, which begins with prioritizing and identifying nursing diagnoses. Nursing diagnoses and patient outcomes, which are established during the planning step, help the nurse determine appropriate interventions for patient care. Ultimately, nurses are accountable for formulating accurate nursing diagnoses and intervening appropriately. By collecting accurate and complete assessment data and articulating concise nursing diagnoses for each patient, the professional nurse has a significant impact on patient care outcomes and the quality of patient care and patient satisfaction. The next phase in the nursing process is the planning phase.